Good day, everyone. You're welcome to SmartSpark Academy. If this is your first time coming across our videos, like, comment, subscribe, and share with your friends. Today we'll be looking at the breasts. It's a very important anatomy question or anatomy area, the breast. So now the breast, look at the description, content, extent, and some important aspects to note when talking about the breast. So now let's start with the description. Now, description of the breast. Now, this is a sketch of what the breast looks like. Remember that in anatomy, you should always give your lecturers diagrams and you extra works. Don't worry, I will label this soon. I just want to explain with this. Now, the breast is the most prominent superficial structure found on the anterior thoracic wall, especially in women. If you look at a woman, if you see a girl, the first thing you notice if you look at her anterior, if you look at her anteriorly, like if you're looking at her front, is the breast. Why? Because it is prominent. It is outstanding. Yes, let me use that word. It's a prominent superficial structure. Where is it found on? The anterior thoracic wall. Now, now I've labeled my diagram of the breasts. We have the sternum, the axillary process of the breast, the nipple, the areola, the serratus anterior muscle. We have lobules of fat. We'll use this diagram to do a lot of explanation on the breast. I want you to note that the most superficial prominence on the breast is the nipple. Like the most outstanding structure on the breast is the nipple, and it is surrounded by a circular pigmented area of skin known as the areola. Normally, if you look at your body in the mirror, as especially females, even the males too, you notice that there is something like a black circle surrounding your nipple. That black area is called the areola. Now let's look at the contents of the breast. What and what can we find in the breast? The first thing we have the glandular and supporting fibrous tissue embedded within a fatty matrix. If you should look at this diagram, you notice that I labeled something called lobules of fat. Now, in this fatty matrix, there are fibrous tissues in it. There are glandular and supporting fibrous tissues there. Now, we have blood vessels like the artery, veins, and all that. We have lymphatics, lymph nodes, and we have the nerves. So these are the contents of the breast. Now, let's look at the extent of the breast. Transversely, the breast extends from the sternum to the mid-axillary line. Now, let me use myself as an example. You know that your sternum is in the midline of your body. The breast extends from here to the mid-axillary line. Your axilla is towards the lateral section of your body. So it's going horizontally this way. Now, if we want to consider the extent of the breast vertically from up to down, you can find the breasts on the second to the sixth rib. So transversely from the sternum to the mid-axillary line. Then vertically from the second to the sixth rib. Now I still want you to note that the breast lies on the pectoralis major and minor muscles. The pectoralis major muscle and the pectoralis minor muscle holds the breast. Now, two-thirds of the bed of the breast. Okay, let's look at the bed of the breast. The breast is not just standing on the so it's lying on something. Now, what is lying on, we call it the bed of breast. Now, the bed of breast lies on two-thirds of the pectoralis major muscle. Then the remaining one-third, it lies on the serratus anterior muscle. I think we are done with the extent, yes. Let's look at some important points to note. If you're asked to write on the breast in an exam, or you have to explain the breast, there are some important points your lecturer will be looking out for, like the retromammary space, the latissiferous sinus and ducts, and all that. Let's look at that. We'll look at it one after the other. So now we are done with the description, content, and extent. Before we move further to the vasculature of the breast, there's some important features, there's some important points that your lecturer actually looks out for whenever you're asked to discuss on the breast or to write on the breast. We want to talk about those important features or points. The first we have is the retromammary space. We also have the axillary process. We we have the suspensory ligaments, we have the lactiferous ducts and sinus, and we have the sebaceous glands. So let's talk about the retromammary space. Okay. Now I remember saying that the breast lies on the pectoral fascia. Now, before it lies on the pectoral fascia, there is a space there. There is something like a loose subcutaneous tissue plane or a potential space. That's what we call the retromammary space. It is a space, the name also already gives it out. It is a space. Now this space, this plane, this tissue plane now gives the breast freedom to move. You can try it out. Okay. If you notice, because of the retromammary space, the breast can move upward, downward, sideways. Just try it out, especially the females. If you notice that there is no movement on the breast, like it's difficult for your breast to move, that means this retromammary space is not there, and it's a sign of breast cancer. So it's very important. It's a very important feature of the breast. The next thing is the axillary process. Now, from our diagram, some lobules of fat gives off into the axilla. It's what forms the axillary process. You can check it on your body. You feel like some breast fat, we call it lobules of fat, it gives off into the axilla, into the armpit, which forms the axillary process. Axilla is also known as armpit locally. Now we now, the suspensory ligaments is what attaches the breast, firmly attaches the breast to the dermis of the overlying skin. You know that the dermis is the inner layer of your skin. Now, what attaches the breast to this dermis is the suspensory ligament, attaches the breast to the skin. Don't forget that retromammary space attaches the breast to the pectoralis major muscle, while the suspensory ligament attaches it to the skin. I don't know if you're getting it. Upwards and downwards. What attaches it upwards is the suspensory ligament to the skin. Retromammary space attaching it downward to the pectoralis major muscle. Sorry for the breaks, by the way. We have lactiferous duct and sinus. When you hear lactiferous, lactating, what should come to your mind is milk, breast milk. Now this lactiferous duct connects to the sinus. Sinus is like small packs or bags in the breast that holds breast milk. Now breast milk accumulates here. Now when the baby suckles on the nipple of the mother, it stimulates the secretion of breast milk, then comes out through the lactiferous ducts, comes out through the nipple into the baby's mouth. That's sebaceous gland. I don't know if I said, but I want you to note that the breast is a modified sweat gland. The breast is a modified sweat gland. Now, the nipple has sebaceous glands. Now, the sebaceous glands secretes an oily substance which lubricates the nipple and the areola. As I've noticed sometimes, especially towards in your menstrual cycle, towards your ovulation or your menstrual period, you notice that your nipple is kind of oily and shiny. The effect of this sebaceous glands. Now we are done with the important features of the breast. Let's look at the vasculature of the breast, the arterial supply, and the venous drainage. Now we'll talk about the vasculature of the breast. We have the arterial supply, venous drainage, lymphatic drainage, and nerves of the breast. Sorry. Yep. And nerves of the breast. So first things first, let's discuss the arterial supply of the breasts. The first thing we have is the axillary artery. Now, the branches of the axillary artery that supply the breast are the lateral thoracic arteries and the thoracoacromial arteries. They come from the axilla. So, when we're looking at the axillary artery, we know the two major branches that supply the breast, which are the lateral thoracic artery and the thoracoacromial arteries. Then, secondly, we have the internal thoracic artery, which originates from the subclavian artery. Now it have its two branches also, which is the medial mammary branches and anterior intercostal branches. Now this one now is from the thoracic wall, the middle part of your body. Now we have the medial mammary branches and the anterior intercostal branches. I've talked about the axillary artery, which is coming laterally. We've talked about medially, which is the internal thoracic artery. And the last one we have is the thoracic aorta. Now, the posterior intercostal arteries, which are branches of the thoracic aorta in the second, third, and fourth intercostal spaces. So that's that on the arterial supply of the breast. Now, the second thing we have on our vasculature are the venous drainage. The main vein in the axilla is in the breast, sorry, is the axillary vein. This is the main vein of the breast, the main vein that drains the breast, the axillary vein. Sometimes the internal thoracic vein can still drain the breast, but this is the main vein. Now let's look at the lymphatic drainage. Now, for the lymphatic drainage of the breast, lymph passes from the nipples to the areola and lobes of the mammary glands to the subareolar lymphatic plexus. Subareolar lymphatic plexus. Now, lymph drainage in this subareolar lymphatic drainage is as follows. The first one, now, from the diagram, you can see the breast is divided into four quadrants. The upper outer quadrant, upper inner quadrant, lower outer quadrant, and lower inner quadrant. Now, most lymph, especially from the lateral breast quadrant, which is the upper outer and lower outer, drain towards the axillary lymph nodes. Now, the lymph from this outer part, the lateral part of your breast, drains to the axillary lymph nodes. Now, while those from the inner part, yes, the medial part of your breast, drains either to the parasternal lymph nodes or the internal mammary lymph nodes, can still drain to the other breasts. So that's that on the lymphatic drainage. Now finally, we have nerves of the breasts. Now, the nerves of the breast is mainly from the anterior and lateral cutaneous branches of the fourth to sixth intercostal nerves. You can get nerves of the breast from the supraclavicular nerves, small contribution from the supraclavicular nerves. So that's that on the nerves of the breast. So finally, we cannot talk about any topic in anatomy without considering the clinical. So I'll just rush this up. You can make more researches and add it up for your lecture as well. I think I'll be giving you just two. Now, the first one is breast cancer, metastasis of cancer cells, breast cancer. The second one is damage to the intercostobrachial nerve during surgery. Now, during surgery, most times error can happen, mistakes can happen, and then there can be damage to the intercostobrachial nerve. Now, this will cause loss of sensation to the upper arm. So that's that on clinicals on the breast. So if you've watched up to this point and you've enjoyed the topic, please do well to like, subscribe, and drop a comment. If you have questions, please drop it. And if you have any other topic you want us to talk about, want us to discuss, please drop it. Thank you for watching SmartSpark Academy.